Hi, hi everyone. Welcome to another Fresh Dental Shadowing session. Today with us we have Dr. Khara Gresham, who's a general dentist, and she'll be sharing her journey with us. So, Dr. Gresham, whenever you're ready.
Hi, thank you for having me. And like she said, my name is Dr. Gresham. I'm a dentist. I practice in Boston, Mass. The office I work at is called Trinity Dental. It's right in downtown Boston. And just a little kind of overview. We'll go kind of like about me, my journey. We'll talk a little bit about specializing or not specializing, and then private practice versus corporate dentistry. And then we'll do a little bit of like a typical day, some dental service trips that I've been on, and then some cases. And after that, if there's any questions, we can go over them. So for undergrad, I went to Brown University in Rhode Island, and then I went to Tufts Dental School, which is in Boston, not too far away. When I was choosing dental schools, I really wanted to be in a city. From Philadelphia originally, so I'm just like a city person. I knew I wouldn't do well in a smaller town, so that's how I picked my dental school. I only applied to schools that were in major cities, which really narrowed my choices down. But I think if you're interested in dental school, it's hard and it's long, so you want to live somewhere where you'll be happy, and not just about the school. I also picked Tufts for its ranking. At the time, I think it was like top 5 dental schools, so that was appealing. Now I think it's kind of dropped down a little bit on the list, but still a really good school. It's one of the bigger dental schools, which for me wasn't a problem. Our class size was like 170 people, and I know some other dental schools have much smaller class sizes. So if that's something that you think would be a factor, just make sure you pay attention to that. I also paid attention to how happy the students were. Because again, dental school is hard, and it's a very long process. So I just wanted to make sure that the students, they really liked it. They felt supported by the staff. They felt like it was a good experience. And of all the schools I visited and interviewed at, Tufts seemed to kind of have that best overall feel. In terms of scholarships, I applied for a lot of scholarships. I didn't really not that many, but I did apply for scholarships. I got a merit scholarship from Tufts, and then I'm in a sorority that is a national sorority, and they happen to offer a scholarship as well. After dental school, I did not do a residency, but I did a dual degree DMD and MPH, so a Master in Public Health program. So it was kind of the first or second year that Tufts had done that program, so it didn't completely align. So the year after dental school, I stayed at the medical school to finish my Master's in Public Health. So that's kind of why I didn't do a residency, but I also don't think I would have done one either way. Now the DMD program, DMD MPH program, it starts like the first day you start dental school, so you'd finish at the same time. I really enjoyed it. I, at the time, thought I wanted to be like a community health, public health dentist. Since then, I've changed. Obviously, I'm more of a general cosmetic dentist, just in terms of like what type of dentistry I was able to do as a community health dentist. It wasn't what I ended up liking to do. So would I recommend residency? I think if you're applying now with COVID and kind of the limitations that people have in terms of like how many patients you're able to see in school, probably. But overall, I didn't think a residency was necessary. I think it also depends on where you go. Tufts was really, really good about making sure everyone saw the patients that they needed and had a good amount of requirements. And I've heard from friends at other dental schools that sometimes it's hard to get chair time, sometimes it's hard to see patients. So it really just depends on what your experience there is. Also, I didn't want to specialize, so that's also why I didn't do residency. So if you're obviously you want to specialize, then you have to. So like I just said, I did not specialize. I really couldn't choose a specific area of dentistry that I loved the most, especially in my 4th year of dentistry or dental school. I didn't think I had experienced enough to be able to say that's what I want to do for the rest of my life. I really liked a bunch of different aspects. So general dentistry gives you the opportunity to pick and choose what you like to do. So if you like to do endo and veneers, and you can just do that. If you don't like extractions, you don't ever have to do extractions again as a general dentist. But if you like doing some, you can kind of tailor what your day looks like as a general dentist, versus if you specialize, then that's what you're doing for the rest of your career. And for me at the time, I just couldn't make that decision, and I still don't think that I would want to specialize. I really like kind of how I've curated my career. And you do get a lot of flexibility. The procedures I do every day are all very different. It's not mundane. I don't really feel like it's too repetitive. So again, that's why I didn't specialize. So for me, a typical day, we start at 8, which is great. I used to work at an office that started at 7, which was terrible, but starting at 8 to 4, which is just like a, pretty easy day. We have a huddle with our staff in the morning. We'll see either 3 or 4 patients before lunch and same 3 or 4 after. If we're doing any bigger cases, we'll try to schedule them all in the morning. So that way we don't get burnout doing other stuff during the day and then start a long case in the afternoon. And that way also, usually patients are less stressed in the morning than they are seeing them later in the day. In a day, do another huddle and kind of prepare everything for the next day. And I do a mix of everything. So I do endo, which is root canals, implants, extractions, grafting, whitening, Invisalign, veneers, crown and bridge. And I like fillings, but I try not to do that many of them. I really like doing kind of a little bit more complex kind of surgery stuff. And obviously, in terms of patient satisfaction, like Invisalign and veneers, stuff like that, it makes patients really like happy at the end. So everyone loves doing those. But again, I like it because I get to do a little bit of everything. And in dental school, I did a global outreach through Tufts. We went to Zambia for almost 2 months, and we were in 2 parts. We were in the major city of Zambia, and we worked in an orphanage doing oral hygiene instruction, oral screening, and some minor dental work there. And then after, we went to a really rural village and did extractions, cleanings, some preventative restorations in the community there. And then over the years, I haven't gone back, but I stayed really active with the program, and we've helped raise enough money to build them a birthing center in the smaller village. So it's really cool. I would definitely recommend it. Like I said, I did MPH, so public health and global health is something I was really, really kind of focused on when I was in dental school. So it was a really awesome opportunity. And it just helps you see like how dentistry is done other places, what access people have to dentistry and dental care, what access that they don't have. Zambia is really cool. They have a really, they have their only one dental school in the whole country. And I think my professor and the professor from Harvard that also came were like 2 of like the 50 dentists in the whole country, which is pretty interesting. But then they have what's called like mid-level providers, which is I think they're starting to bring that here, but they're not dentists. They're a little higher than like a hygienist or a dental assistant, where they can do some dental procedures. Like they could do extractions and different like emergency kind of care to provide people access in the rural areas. So that was an interesting experience, and I had a great time. Hopefully we're trying to go back, but COVID has kind of put everything on the back burner. And these are some of my favorite cases, just because the patients were really happy. This lady, she said she fell, but I think she got into a fight. But we were able to, we have a CEREC machine, which is a machine that makes crowns and bridges the same day in office. So we were able to, prep her teeth, put her in some temporaries, and then we printed them out, and she came the next day for her bridge to get delivered. She was really, really happy, versus, sometimes when we send it to lab, it takes a couple weeks. So I think she had some of it. She was really happy to get everything done that same day. This case is actually, I wouldn't say it's my favorite case. It actually gave me the most stress, because she was really, really concerned. It's for her wedding. She was really concerned about the aesthetics. She wanted her front 2 teeth done. I was just very, we had a short turnaround, and I don't know, I'd stressed about it, but it came out really, really well, and she was super happy. So we did some gum grafting and veneers for her. And this guy, it wasn't anything like very extensive or crazy. We really just made him dentures. He had 2 implants placed on the upper and 2 on the bottom as well. And then we just made dentures that snapped on. He said he hadn't eaten steak for like 20 years. And after we finished and kind of delivered everything, he invited me to go to dinner with him for steak. Obviously I did not go, but he was so happy. And every time he comes back, he's like, I'm able to eat everything. So it really just kind of confirms why I went into dentistry, to change people's lives and, get them healthy, because health is not just, like mouth and body's connected to the rest of your health. So he wasn't able to eat. He like gained weight after good weight because he was a little bit skinnier before. And kind of just really his health took off. And the last one is we did crown, like a combination of crowns, bridges, and veneers on her. And she's kind of midway. We're actually almost done. We placed 2 implants on the bottom, and that she's getting them restored actually in December. So coming up soon, we'll be completely done with her case. But it's she's kind of looks completely different, and she's so happy every time she comes in. She always smiles. So again, it just really confirms why I wanted to do dentistry and why I just kind of switched from public health to be able to do more cosmetic procedures. And that is it, I think. Yeah. Is there any questions that people have?
Yes, so now we're gonna move on to the Q&A session. So I had a question about, do you work for a private or corporate office, and like what are the differences, and how did you decide?
So I actually work in 2 different offices right now, and then I'm in the process of opening my own practice. One office is private, and I'm there like 2.5 days a week. And then the other office is corporate. And the differences are, in the private office, I'm paid differently. So in the private office, I make a % of production. So if I make, whatever, let's say $1,000, then I make 35% of that as my take home. And in the corporate office, I'm paid a salary. And that doesn't change. It doesn't matter if I see 1 patient today or 20 patients. It doesn't change. And there's pros and cons to both, right? So in the corporate office, I don't really have to worry about what money I'm making. I'm always getting a salary. But in the private office, it's kind of dependent. If I only see 1 patient, then obviously I'm making a lot less than I'm making if my schedule is full. So when you're first starting out, it might be a little bit more stressful to be in a private office, but then once you have an established patient base and you kind of know what cases you're doing and how to tailor your schedule, it ends up being, for me at least, better. But it really just depends on what you value. If you don't want to be stressed about it at all. Also in the corporate office, I have benefits where I have health insurance and they pay for my malpractice insurance and different things like that, which in the private office, they don't. When I buy my own practice, I'm going to be leaving the corporate office. So kind of everything will be on me. But I think, with more responsibility comes more opportunity, be able to make more money. You're a business owner, so there's just different tax implications there that end up being better. But obviously, again, the start off process might be a little bit more challenging than if you're working for a corporate office. In terms of procedures, I think I do the same things at both offices. I think I'm really lucky. But I've heard people who are at corporate offices, they're kind of, they're a little bit more strict, I guess, on what they can and can't do. My office has been like pretty lenient in letting me try different procedures, or if I don't like certain procedures, I don't have to do them as long as I'm producing a certain amount. But sometimes corporate offices, you see a lot more patients, you have to work a lot harder, and the dentistry is it's less about individual patient interaction versus just seeing enough patients to meet your quotas. So it depends on what you're looking for and the type of dentistry you're doing.
Yeah, it's interesting to consider both. So I know you mentioned some of the procedures you do. Do you have any favorite procedures?
Favorite procedures, I would say I actually really like extractions and implants. They're just really satisfying. If a patient comes in take out the tooth, they're not in pain anymore. And then implants, I love the surgical aspect of it and the kind of flexibility you get in restoring cases. So I'd say that's my favorite. Least favorite would be root canals, not because I don't really like them. They're just kind of tedious and take a long time. And sometimes it's just not worth it, but it just takes a long time.
So another question has to do with the evolving of dentistry, because I know there's a lot of new technologies that come up like over the years.
Yeah.
How does your office learn about new technologies, or do you have a favorite technology that you use?
Yeah. So depending on your state, there's going to be certain continuing education requirements you have to do. So in Boston, in Massachusetts, you have to do 40 hours of continuing education every 2 years, and the ADA tracks that. So you always have to go to conventions. You always have to learn a certain amount, and you could pick to only do implant courses for 40 credit hours, but usually people do a kind of a mixture of different classes. So that way we're always staying abreast. We're always learning about new procedures and new technologies that are coming out. And usually the continuing education is done at the big conferences. So in Boston, we have Yankee Dental Conference. There's, one in New York, Greater New York. There's kind of people travel around to go to the dental conferences. And then on the floor, there'll be all the dental companies that will have all their equipment and all the new technology. And you kind of just walk around and learn about what's going on. I also always stay in touch with my friends from dental school, and we're always kind of talking about different technologies and different things that we're doing in our offices. With the office that I'm buying, it's from an older doctor who doesn't have a lot of technology, so that's something I'm going to have to do is update and kind of upgrade a lot of his equipment, which is expensive, but I think patients really appreciate it, and overall it makes for better dentistry for sure. I'd say my favorite technology is scanners. Not necessarily scanners like CEREC where you can make the crowns the same day, because those are really beneficial, but sometimes having a human make it, at a lab gives you better quality and control, but just being able to scan for Invisalign cases makes you much faster. Your turnaround time is faster. And for patients, instead of having to take loopy impressions and dealing with gaggers and stuff like that, they really appreciate having the scan. And also just patient education, because you can scan and then on the screen you can just show them their teeth immediately, versus if you take impressions you have to pour it up, and it's harder for them to visualize, versus if you scan it they can really see what's going on. And the scanners now are really in depth, so you can see the difference between tooth structure and fillings and different types of fillings, so you can really get a really cool model of the teeth, and patients can say, oh wow, I didn't know that my filling looked that bad. Now I definitely want to do XYZ treatment on it. So makes it better for case acceptance and just easier overall.
Thank you. So the next question is about your service trip to Zambia. I know you mentioned a little bit, but do you have anything that stood out about the cultural differences regarding to dentistry over there compared to here in the US?
Yeah, so there wasn't a lot of access to dentistry, for a whole, it's a huge country, it's huge, it's huge. I don't know the exact size, but there's only 50 dentists. So getting to a dentist is, hard for patients, and sometimes they'd have to travel days to get to the closest dentist. So usually the dentistry tends to be more palliative or emergency based. So a lot of extractions, dentures. There wasn't a lot of at least where we were, aesthetic dentistry happening in the major cities. Yes. And it was actually pretty similar to here, but for the most part, it was just kind of emergency care. But what was cool was the patients, they don't have as much decay as they did periodontal disease and broken teeth. And that's because of diet. Here we have a lot of processed food and, high carbohydrate foods that we're eating, versus they're mostly farmers and living in rural communities, so their diet's actually really, really good. And their teeth aren't as susceptible to decay because just the diet they eat from birth is better than what we eat here. And also breastfed a lot more than we do in the States. And breastfeeding actually is like naturally preventative to decay for infants as they start. So teeth wise, they were stronger and less decay, but then because they're not brushing as well or don't have access to like, new toothbrushes and floss and stuff like that, there was a lot more like gum disease, and they'd lose teeth because they'd get loose and come out, or because the diet is also, for whatever reason, they're chewing a lot of bones, they'd crack more teeth than I would see patients here. So it was cool to see culturally.
Yeah, I like seeing the cultural differences when I travel. Cool. So another question is about going back to your undergrad career. What type of manual dexterity did you practice to prepare for dental school, or like, do you have any recommendations of what we should do as pre-dental?
We didn't. I think that's something that's kind of evolved to more now than it was then, but that wasn't anything that they really focused on when we were, when I was applying. I did a lot more studying for like the perceptual ability part of the DAT test, because for whatever reason, I thought that was not more important, but I didn't really do any dexterity anymore.
That's fine. So for the interview process for dental schools, do you have any tips?
Yes, but I also say that you can't like practice dexterity. Like whatever you practice is not going to be holding a hand pieces, and like you'll never, until you do it. Cutting a tooth is a once in a lifetime, well, not once in a lifetime because you do it forever after that. But like there is nothing else like cutting a tooth. So, I mean, if you are able-bodied with both of your hands, you'll be fine for that part of it. In terms of the interview, I would say really focus on each school. Like make sure if you say you want to go to Tufts, then you like really scour the website of Tufts. You get as much information as you can about the school. So that way when you come in, you have good questions for whoever's interviewing you, and they're not like vague kind of go-to interview questions, but you can really say like, oh, I see you have an X department, or that this person works here and he's really good at prosthodontics and I'm really interested in that, like tell me more, something like that. So that way they can tell that you're really interested in that school and not just like any dental school in general. I would say try to get a feel, as much as they're interviewing you, you should be interviewing them as well. You really do want to get a sense of like what type of students are there, what type of faculty are there. I think that really makes or breaks your experience is if you have like supportive staff, supportive faculty to get you through it, because otherwise, I mean, like I think I've said a bunch of times, it's very stressful, it's hard, but I think Tufts really went above and beyond to make it a supportive environment, where I have heard at some other schools it's not the same experience. So depending on what you want and what you need from the faculty, just kind of ask those questions to see what kind of resources they have available and what type of kind of faculty base that you're working with.
Thank you for that. So another question still about dental school. Any advice that you would have liked to know before going into dental school?
Advice before dental school. I would say, I mean, you'll get through it for sure. So don't get so like focused on, studying and doing all the things. Like just, you have a life to live as well. And you have to focus on your mental health and your like happiness as well to be able to do the work appropriately. And I would say from a patient perspective, what I've heard, because I mean, Boston has 3 dental schools that all see patients here. So sometimes I'll see patients in the chair and they'll say, yeah, like the dental school is really good, but like the students, like they don't know how to talk to us. Like they I can tell that I'm just a requirement for them. So I would just say, when you're treating patients at this, school, just remember to kind of communicate with them, talk with them, ask them more information about themselves. Like, yes, you need them to do X amount of fillings on, but just because they're at the dental school versus seeing someone in private practice doesn't mean that they're, less nervous about being at the dentist, or, less deserving of kind of like a comprehensive care environment. So I think that's something I wish I knew, because I definitely was like, nope, I have to do 10 crowns. So I would see a tooth that needs a crown and maybe get like so focused on making sure I get the crown done versus getting to know the patient, because the more you know the patient, the more they're willing to do. And that's been something I've learned when I got out of school is, the more the patients like you could be the worst dentist ever. They don't know, but they know they like you and they trust you, and then they'll tell other friends to come. So that's kind of the most important part.
Yeah, dentistry is definitely a people career.
Mm-hmm.
Okay, so for more advice, do you have any tips for transition after dental school when people are trying to figure out where to go from there and to start the profession?
Yeah, I would say be like as intentional as you can. I know at that time, like there's so much going on, but be as intentional as you can about where you want to be and what kind of dentistry you want to be doing, because that'll make it easier to kind of plan whether or not whether you want to go to residency or where you move, or what type of jobs you take. I think some people, especially now with COVID, people are maybe nervous about getting a job, so they might take whatever job they get, but just make sure that the office is the type of office that you want to work in. Does it have the technology there that you want to use? Does it see the kind of patients that you want to see? Or when you're doing your interview, kind of ask what type of procedures they're doing. Because if you like Crown and Bridge and you go to office and they do more extractions and fillings, then you're not going to be happy where you are. So just kind of be intentional about which not careers, like which offices and which jobs that you take. Because the worst thing is getting into an office and a year later, then you'll want to change. I'd also say, enjoy it. It's fun. It's like, I have never looked back and said, oh, I wish I was something else. Like, I'm always like so excited about the career. It's only gotten better with time. I think it's got great opportunities. So I would definitely say just kind of stick in there and it'll be worth it for sure.
So the next question is another question about dental school.
Mm-hmm.
Do you have a favorite and least favorite class or topic?
Mm-hmm. My favorite class, and Tufts had like a public health, like outside of the MPH I did, they did a public health course as well. So that was my favorite part. Really kind of just learning about cultural differences. That was the only class that taught me kind of how to communicate with patients and teaching like talking in plain language versus throwing a bunch of dental terms at people that they're never going to understand. So that was my favorite class because I think it was the most applicable outside of obviously the classes for learning how to do the dentistry. And then what was the second part? Worst class or just the favorite?
Favorite or least favorite, both, whatever you want.
Least favorite was I don't think I have a least favorite. Sometimes I hated just doing all the work, but I don't think I had a least favorite. Second favorite was gross anatomy. It was really hard, but I thought it was really cool to have the opportunity to work on a cadaver. I think that's a once in a lifetime experience that most people don't get. So I really I don't want to say enjoy, but
something different.
Yeah.
Okay. So what do you think is the most challenging part about being in the dental field?
Patient, like happiness and case acceptance. And I'd say the dentistry is easy as, once you get a couple years under your belt, like doing dentistry is like, I never wake up and I'm afraid of like what dental procedures I'm doing. Like that, I don't even think about, but I do get stressed out. Like if I see a patient on the schedule, like today I had one that I saw her name and I was like, today's going to be terrible. I had anxiety, like working up to when she got there. And the whole time I was like sweating, and then she left. And it's nothing to do with the dentistry. If I did it on any of you, I wouldn't even blink. But she's just like a stressful person. And I don't want to say she's mean, but she's a lot. So patient management, managing patient expectations, I think that's the hardest part for me, at least. And then now that I'm opening a practice, the admin side, because I don't really teach it in dental school, that I think is going to be the hardest part, because it's something new that I'm gonna have to learn. I'm gonna have to learn how to do payroll, have to learn how to work with insurances and stuff like that, where, luckily there's an office manager already there, but it's something I've never done before. So that part is a little scary.
Since you mentioned like patients who are stressful or stressed out themselves, how do you manage like patients or help them calm down their nerves if they have like phobias going to them?
Yeah, I mean, I just try to talk to them. I think what's helpful is like sitting down and like looking at them eye to eye versus standing up and kind of towering over them. I think makes them a little bit more anxious. So you like sit down and just kind of like ask them what's making them nervous, and is there anything that you can do specifically to kind of ease their anxiety. Also explaining everything in clear, like very regular language, not dental terms. Like, oh, we're going to do a crown and number 14. Like most people, like, I don't know what that means. So if you just explain it in a way where they understand, and kind of give them like little, like, I'm always like, it'll take an hour and we'll give you breaks, like just making sure that they know that they have some type of control over the situation usually helps. And then sometimes it's like they get hot where patients are hostile, not because they're afraid of the dentist, but it's expensive. Like dentistry is expensive, insurance is trash. So a lot of times patients have a lot of nervousness around cost, and they're afraid of discussing cost. So I try to just be as candid as I can about it, and making sure that I give them options about how to, treat them, and to say, we're going to figure out a way to get everything done and make it work for your budget. So that usually makes people calm. Yeah.
So the next question is about time management. Do you have any tips for it, like how to manage your personal life versus the office life?
You just have to dentistry is easy in that way, because whatever time this office closes is when you're done. You can't really take dentistry home, which is really nice, and part of why I picked dentistry as a career. So really, there's not unless your office you work at is saying that you have to work from 7 to 7 p.m. Usually, when the day is done, the day is done. So it's not that hard to balance office life versus home life. In dental school, I would say it's much harder because you always have to study and there's always something to be done. But I would just say make time for yourself. So whatever that is, I run a lot. So I'd always just say I need to run X times a week. And I'd always try to fit that in to make sure I had time for, my mental sanity, because otherwise it'd drive you crazy. But I just say, just be intentional and don't get so laser focused on doing the schoolwork that you forget about other things.
So another question is about research. Did you do any research in undergrad or in dental school, and was it helpful?
I did not do any research, but I think, no. So Tufts has a really good dental research program, and people who did it loved it, but I personally didn't do any research. Is it helpful? I'm sure that it is. It just wasn't what I was interested in. I was more interested in public health and doing that program.
And I know you mentioned in your presentation about scholarships, and it's probably harder to find scholarships for dental school than it is undergrad.
Yeah.
Do you remember any resources that you used to find them, or how did you go about
I kind of really just searched scholarships for dental students. And then I would focus on I've got this one scholarship from the Philadelphia Book Club or something random. So I'm from Philadelphia. So go to your hometown. So sometimes there's smaller scholarships or, programs that have some money that's available for, someone from that town. I know Boston, I'm on the Brown Club of Boston board, and we have a scholarship, and it's really just for any Brown student who moves to Boston, and they just to kind of apply to it. It's very vague. I didn't know about it, but if someone who went to undergrad at Brown was looking for a scholarship, they could apply to this and get it. And it doesn't really, we don't say where it has to go. They can use it for whatever they want to use it for. So just smaller scholarships like that, like maybe from your undergrad or from your parents' undergrad, or some your aunts or uncles. So kind of just reach out to your network and see what different programs and groups that people are part of.
Thank you. So another question. How did your study habits change from undergrad to dental school? Because I know the workload is 10 times more in dental school.
I just did the same things, but for a longer period of time. But I like to study, not with the group, but like to have study partners that I can always like bounce ideas off of. So find what works for you. So if you know you need to be by yourself, then make sure don't change what was working for you in undergrad. So whatever you did in undergrad that worked, kind of stick to that, and then add on little things here and there. But for me, I need like 3 or 4 people. We would study in similar areas, but not necessarily in the same room. And then we'd come together and just like bounce questions and stuff like that off each other. That's what I knew I needed. So I made sure to find that when I got to dental school. But I would say share with your classmates. Like sometimes people already have a study guide that they made. So just try to get to know people and see if they'll share those resources. Like it's not gonna, you still have to do your own studying, but you might not need to write out all the things or draw all the diagrams, because I'm sure someone has done it already. So just, kind of interact and network with different people. For smaller dental schools, it's probably easier, but Tussauds, like it was a huge class. So there were some people that I knew I didn't really talk to, but for when it came time to study, I could reach out to them and say, oh, did you do XYZ thing? Yeah.
Okay, so since I know there's a lot of pre-dental students watching this, do you have any tips for personal statements or resources for studying for the DAT?
I can hear the second part. There's something in the background. Say it again. Personal statement and then what?
DAT resources.
I took the Kaplan DAT course, and I don't know what I would have done without it. So I would definitely, it was online. It wasn't in person, but just they have like so many questions that you can go through, like flashcards that you can do that are like kind of virtual. And then the book had pretty much all the information that I needed for the DAT. So I would say definitely use some type of source like that. It doesn't have to be Kaplan. And then do as many practice tests as you can. That's kind of what I did to familiarize myself with the process and kind of like the style of questions they're asking and the flow, like just as many as you can. And then for the personal statement, I would say, again, just like for interviews, you just focus it on the school that you're applying to. So they know that you're interested in that school. And then also just set yourself apart, because everyone who applies to dental school did well in undergrad. Everyone has, I'm sure, decent or good DAT scores. So really say why you feel like dentistry is for you, and not, that because your mom's a dentist, that, everyone, at least I'm at Tufts, my parents are not dentists, but everyone's mom or dad, somebody was dentist. So it's like kind of setting yourself apart as to why dentistry is like your calling and what you think you can add to the profession, and how you see you changing the lives of your patients, kind of thing.
And for the DAT, do you recommend retaking it? Because I know some people get nervous if you retake it too many times, if that's frowned upon by dental schools.
No, I mean, too many times is, I took it twice. So I definitely say retake it. I thought I was good at math. I took a lot of math in undergrad. So I was like, oh, I need to study math section. The other sections I did really, really well on. The math section, terrible. So I retook it and kind of focus on the math section. And it was like high school math, though it wasn't math I had been learning. So it was like just like little tips and tricks that you forgot from high school that would have made everything easier. So I took it again, and the other scores were similar, and the math score went up. So you should retake it. If you take it like 3 or 4 times, I don't know. I think that they might look at that questionably, but I think taking it twice is not a big deal.
And for shadowing in undergrad, do you remember how many dentists you shadowed and how many is recommended? And do you have any experiences or anecdotes you want to share during your shadowing experience?
Yeah, I shadowed 2 dentists, and I needed like some 100 hours. I don't know how many hours I needed. I would just check each school, make sure whatever school you're applying to, you're hitting whatever their requirement is, because for each school is a little bit different. They were both in Philadelphia. One was my current family dentist, like who I was seeing. And then the other was my dad's friend, who we never actually saw him as a dentist, but my dad knew him. And he was definitely illegal looking back on it. Like, he let me clean someone's teeth. He let me kind of like he would tell people that I was a student, like learning dentistry. So I think they thought that meant dental student, but I wasn't. I was like definitely an undergrad. So patients didn't ask questions though. So that was the coolest experience. And I was like, oh, no, definitely want to do this. But it was, they were very different offices. His was very small and just him and one assistant. The other office was a bigger office with like 3 or 4 dentists and a lot going on. So it was cool to see different types.
And you also said you're thinking of opening your private office.
Mm-hmm.
Could you talk about like the management aspects of running an office, or what you've seen based on your experience?
I don't know yet. I haven't. So the office is opening in February, so it's coming up. But right now, I've just been kind of picking my office manager's brain just to learn insurances, because there's so many different kinds, and like how they work, how you even just charge patients based on what insurance they take and what your office fees are. And then I've been working on trying to figure out payroll, and just I had an accountant now, so he's figuring out a lot of stuff. So it's definitely manageable. People do it all the time, so I'm not going to say that it's not possible, but it's definitely a learning curve for sure. I'm sure I'll get some things wrong, but that's part of the journey. So I think as long as you have a good team around you, that you'll be fine. Like, I have an accountant, you have a lawyer. I've got a bunch of friends who just opened practices like last year or the year before. So every day I'm calling them like, okay, what do I do now? And so I would say just try to, reach out to as many people as you can that can help you. Because I definitely wouldn't be able to do it by myself.
So for the last question, this one's a little more creative, but is there, if you could change something about dentistry, what would you change?
Oh, if I could change something about dentistry, it would definitely be like insurance reimbursements. I think that's the biggest hindrance to access to care. Massachusetts has a pretty good Medicare, Medicaid dental system, but I have friends who work in other states where they don't cover anything. Like Florida has a really terrible like Medicaid dental, so patients really can't afford care. So if I could, I would change how dentistry is handled in terms of the insurance. I think patients think that dental insurance is like medical insurance, where it covers most things, and then they have a small copay. But really, dental insurance, like we like to say, it's a coupon. It'll give you $1,000 off, but when your treatment plan is $5,000, you have to figure something out. So I would, either make it more like medical insurance, or figure out some type of in-office payment plan for patients there. The other thing I would say is that, not that I don't want a job, but dental disease and caries are completely preventable. And it's really heartbreaking to hear patients say like, oh, I've had terrible teeth forever, when really it's just that they weren't taught how to brush their teeth, or they weren't taught that their diet is the most important part of why they're getting cavities, and not like, brushing, flossing and stuff like that. Even though that's important, but if they're, chugging Gatorade all day, it doesn't really matter how much you brush, you're still gonna get cavities. And sometimes people like can't see that, or they're chugging coffee all day. They're like, oh, I don't eat candy. It's like, yeah, but coffee's like battery acid. It's gonna ruin your teeth regardless. So I would change how dentistry is taught from a young age to patients. So that way people aren't ending up our age and needing a lot of dental work.
Well, thank you so much for your time and your advice for this session, and thank you for everyone for tuning in.
My pleasure. Thanks for having me. If there's any questions, that you can always email me or Instagram message me.
Perfect.